I don't know. I always have to sing it. But you guys, I am so sorry about last week. As you may or may not know, many of you, we, consider um, Nico Calais family, and in light of his last week episode and issue, I took a beat because I was messed up mentally. So thank God he's okay. I send my love and well wishes out to him, and we know that things only get better. He's such a the words for him are so hard to describe because he fights. He's a great guy. He's a great guy. So as we claim him as family, I mean blood relatives, we may not be, but you know, y'all know what I'm talking about. So we are fam. And I'm thankful that he is doing well and back on his feet. You know. So anyway, I took a beat. Couldn't do it because my mind wasn't right. So, anyway, welcome back, everybody. This is episode 73. I am so excited that my podcast is going strong and we continue to grow together and talk about things that in our world and learn about things in our community and learn more and more about what our government is basically trying to introduce us to, whether it's something you believe in or not. Today on Wishes for the World, we're going to talk about mRNA and the vaccine. Now, originally, we know that mRNA was designed to prevent or to vaccinate us for COVID, right? So, with that being said, with this particular uh, vaccine, it was designed. The pros of it with that it would include the high efficacy effect of the mRNA vaccine to have shown high effectiveness of preventing COVID-19, and it has been crucial in the efforts to control the spread of it. Okay, so that's one pro. The other pro was that it was a little faster in the development of it. It worked better. We know Pfizer has been around for 100 and some years, and they're kind of like one of the number one vaccine or medication pharmaceutical companies who house this particular product in their in a very safe vault, basically. But for the most part, the faster development of these vaccines can be developed and manufactured a little bit more rapidly than compared to traditional methods, which is very beneficial. Again, since we had such this health emergency with COVID, it is able to be manufactured in very quickly. But also the pros is that it's considered a safety. mRNA is considered a safety vaccine, so and it doesn't contain the live virus, because every time I go get a flu shot, I don't know about y'all, I always ask, is this a live virus? Because sometimes if you are getting a flu vaccination, the live virus will actually make you a little bit sicker. I know I got to get my dreads retwisted. Anyway, honey. Oh well, my hair is growing. Yay. So with that being said, it's so allegedly being made to a lot safer for us and whatnot. Now, there are some cons, as you may know. A lot of them are people don't want to get them. That's long data. So the data that we have on it is not very, not to say it's not reliable, but it hasn't been around long enough for us to really like say, oh no, should we or shouldn't we trust it, so on and so forth. So because of that, they're relatively new, and so the efficacy of the particular drug is one of the things that we concern ourselves about. The safety of the drug, and although expenses and clinical tests have been done, just we still are concerned, right? And with um, duly so. We should be concerned. Cold storage requirements. Some of the mRNA vaccines have to be stored at a cold temperature, which can pose like a logical challenge because, if there isn't enough area for them to be stored in, unfortunately, they will spoil and go bad, and there won't be any use. We won't be able to use them. So that basically creates a challenge of the distribution of them, especially in the resource limited areas that we have around the world, because it hasn't been around long enough for us to even know. But the vaccine is there's a lot of misinformation, and the vaccine hesitancy can affect public acceptance. Like I said before, where y'all don't want to get them. But it's important just to note that the pros outweigh the cons, and in the healthcare field, we always say benefits outweigh the risk, and so sometimes people can be allergic to some type of medication, but because it will save their life, basically the doctors will say go ahead and give it to them because the benefits of the drug outweigh the risk of the drug. So that's basically what our government is saying about the mRNA vaccine. But originally there was a lot of talk about it being way exactly what it does. Okay, this particular drug, what it does is that it works for introducing a piece of mRNA that corresponds to a viral protein that's usually basically your. Y'all hear my new pets? I got three of them. Jesus, I'm gonna show them to you. Anyway, they're so cute, and they always get to fighting and wrestling, and the little girl is always crying, and it's two girls, but I'll show them to you. Two girls and a boy. But with that being said, it's like I said, important just to realize that the benefits do outweigh the risk of this. But for the most part, one thing about this vaccine is that they were developed by Pfizer. And as I mentioned, Pfizer, Biotech, and Moderna they've authorized and are widely used through the United States government for the pandemic. Okay, so we know that because a lot of you got shots, and if you did, you got ones from, like I said, Pfizer, and you got other ones from Moderna, and so on and so forth. Hey, Rob. Hey, Sue, baby. Hey, Kayla. Hey, everybody. So with that being said, there was so much controversy because when I originally started looking at this yesterday, I was like, wait a minute, they were talking about I was concerned that they were saying that they were using it in a mutation sense, but it isn't used to mutate in any way. It's important just basically that there is accurate scientific information that's going out, and for this particular reason, that's the reason why things are kind of on hold. The mRNA cells, they can produce a viral protein, and basically this viral protein usually has a small piece of protein found on the virus's outer membrane. Okay, so if anything, it is replicating it so that it will, when the virus started, it mutated into so many different forms because everybody has different germs, everybody has different parts of this virus that created more and more and more, and so every time they try to, I think I was not recording over here, so I'm gonna have to upload it. Um, the mute was on. Lord have mercy. Anyway, in talking about the virus, there was a lot of issues about COVID that made people feel like, oh no, why is it so hard to kill? Why is it so hard for them to find a drug? What's going on? But then again, it was a virus that had mutated, and every time it connects to you, me, somebody else, we all have different things going on in our body, different cells, different antibodies, and it would mutate into something different, causing those biochemists to have to figure out how they're going to fix it, how they're going to give us something that will kill it. So, with that being said, by using the mRNA cells, this can actually they produce viral proteins. Now, as a part of a normal immune response, this immune system recognizes that the protein is foreign. And so what it does is it's going to produce a specialized protein called antibodies, and those are what fight it off, right? So with that being said, the antibodies help protect the body, as I mentioned, and in doing that, it's making those pathogens so that they can be destroyed. Those it's making pathogens for destruction. So with that, your immune system can quickly, fight it off, or it can respond against it. It just depends on you. But that's why they are looking more into the mRNA vaccine and how they work. And they basically, help prevent infection is basically what we're talking about here. So when we talk about how we're trying to do that and how the government is trying to do that, again, we hope that it severely impacts the way that COVID has affected us in the past, and hopefully, it'll become like the flu was back years ago during the Depression, where we were able to completely well, we don't feel like we felt about COVID, but at the time, people did feel the same way that they felt about COVID, which we knew. But the FDA, which is the Food and Drug Administration, rather, before it can be used, they, like these types of vaccines and things like this, all have to have authorization of approval, and the FDA is who does that. And so, with that being said, before they can be used, these vaccines have to again prove that they can fight off the disease. They're not going to harm us. And we had like the disease, the SARS, CoV-2 COVID coronavirus rather. Um, are the only unauthorized or approved mRNA vaccines. So they haven't even approved that. And that was, if you remember, was before COVID. And I think that was from the spread of what, mosquitoes or something, So anyway, but the mRNA that directs cells to produce copies, because again, it mutates. So it produces copies of protein on the outside of the coronavirus. So when it does that, that's called a spike protein. And when it does that, researchers, are studying how the mRNA might be used to develop vaccines for additional diseases. So again, it can continue to mutate into something new, but there are a lot of scientists who are working on this to make sure that, because they want to be safe too, right? So it's not just them doing it for us, but to make sure that it is something that protects us in the long term effect, and that it makes us safe, and in the future not have to worry about um, this disease mutating and it not being something that we can quickly get rid of, because it was completely disastrous. Coco Chanel, stop. Okay, so my puppy's name is Coco Chanel, and her teeth are sharper than the kitten's teeth, so she hurts the kittens sometimes. But anyway, so I don't know. I want you guys drop some comments. Put some information out here. Let me know what your thing like it left and whatnot. But this, it's worth talking about. It's back in our news again. It's back in our government, and how they're trying to get this mRNA, how a once dismissed idea became a leading technology in the COVID vaccine race. So they had dismissed this like years ago out in Andover, Massachusetts. They basically, it was like, okay, well, we can't use this. So they put that on the back burner, maybe not ever to use again. However, many basically came up with the help of that it could help the end at the end with COVID. So basically, they stored it in these nondescript metal tanks in a manufacturing complex, which I mentioned was owned by Pfizer. And we know that's one of the largest drug companies. They've been around again for like 170 years plus. So they're one of the oldest Fortune 500 companies, but they've made billion dollars, uh, bet on that dream that they would be able to resolve this situation with COVID. So, we hash young rivals, just 23 miles away in Cambridge. They had tried to fix uh, this as well, which is the modern like biotech companies and billionaire markets that have tried to compete with Pfizer, but the facilities nearby are still working to try and get things taken care of, but it's taking a lot of money. And like I said, the storage and things like that have been issues as well. But yeah, just I just wanted to bring that to your attention. It is a synthetic messenger, the RNA, um, off the keyboard, people, or little people, little animals. So it has basically uh, is synthetic, so it's not live like earlier. But we'll see if it becomes a normal part of our vaccinations. But for the most part, it's been a lot, right? A lot. That's crazy. And the innovation has been quite expensive, you know. So, but anyway, so that's part of what's going on in our world today. And if I had one wish about that, then my wish would be that we would be able to create something that's new and different and be able to make sure that we can all survive in a place and time where we don't have to live in that fear, because that fear was what created, I mean, stress and more illnesses and things like that. So I just thought it was worth talking about, because again, we had so much going on, and I just can't believe. Thankfully, it's been almost 3 years since COVID, and I swear it passed by. Hey, are you fighting? Are you fighting me? Hello, say hi. Say hey, everybody. Hey. That's Dash, because he's always dashing around. And here comes his sister, and her name is Blue. Baby Blue. And I call her Baby Blue because she's always got the blues, always crying. She's funny. So I became a foster mom because they are really not weaned yet. Coco Chanel, oh, and here she is. Come here. Come here, Coco Chanel. And this is Coco Chanel. Coco Chanel is a little teacup poodle, and she's mixed with Chihuahua. She's something else. And her little teeth are stronger than the kitten's teeth. So, she's teething, but we're waiting on her little teether to come in, you know. Lola, hey girl, did you eat your snack? Yeah. Okay. So anyway, those are the little minions that I have adopted, and well, I'm fostering them for about 30 days, and we'll talk about fostering because I think that for a lot of people who are interested in pets, sometimes I now understand why the adoption process was so ridiculous and overwhelming. But we'll get into it a little bit later. What are you licking? Oh, that's your tail. Okay, gotcha. But anyway, he's sitting on the keyboard. They say if you get your cat their own laptop, they'll leave yours alone. So I got extra ones over here. I'm gonna have to give them, I think. Of course, especially when you're trying to do something, they always want to come close, huh? But anyway, so I really want to hear you guys' feedback on this because I mean, maybe everybody's tired of hearing talking about it, and I get that as well. But I think that it warrants talking about because how are you going to handle it if we have enough vaccine? There's a lot of things going on in our world today, and we talked about some conflicts in different countries or whatever. Now, a child died after a car crash into an elementary school in Wimbledon, London. That was really sad. Did you guys hear about that? Oh, so we look to see more about what happened with this family and what went on with the driver. I mean, were they drunk? What happened? Um, I don't understand when things, I mean, they could have been sick too, because, some people have like seizures, but they shouldn't drive and things like that, and they do it anyway. But they're not treating it as a terrorism related incident. Unfortunately, it was a little 8-year-old girl, and it's so sad. She was killed, and several others were injured. That happened today, or well, Thursday, London's time. So they're 7 hours earlier than we are. So it's about 11 o'clock at night right now. There, or we're 7 hours earlier, so there it's about 11 o'clock at night. But they're not treating it like terrorism. It's like I said, a vehicle crashed into a private elementary school, and for girls in the southwestern London suburb of Wimbledon. But right now, the authorities are basically investigating and looking into this situation. Um, but Coco Chanel, oh Lord, she is terrorizing the kitty. Are you going to go save your sister? He said nope. He likes to be up under me. But it was a Land Rover at that, and the driver of the car was a woman in her 40s, basically. And so I don't know if it stated that she was drinking. She was arrested on suspicion of causing death by dangerous driving. And it was a Land Rover. She, according to aerial images of the crash site, which also showed tables and chairs in disarray, and number of witnesses that viewed the situation, but asked people not to speculate as they investigated. You know, people are going to speculate. What else are we going to do? We need to know facts. But the tragedy was horrific, obviously, for residents because they are live in a quiet golf uh, parks and golf course neighborhood with families close to those parks. But the police uh, court they blocked off surrounding streets and urged the public to avoid the areas and just to give their family the privacy that they needed. But that is so sad. So protect the babies, protect yourselves. Um, like I said, send me some listening and how you feel. It'll work with us and help us in the future. But for now, that concludes our world wishes. And like I said, for the one wish I have, it's not just one wish, but my wish is that we do find something that will help our country, our nation, to be able to survive. I'm not sure what the statistics are right now with COVID, but I'm sure that it's still. I've heard people still getting it, so I'm not sure about. People go back and forth about whether or not if you're vaccinated, if it helped or not. I got vaccinated, and thank God to date I have never been diagnosed or tested positive to have it. So I am thankful. I do work in healthcare, so healthcare IT that is, and it is paramount for me to follow the rules. And the rules always tell us that we have to have our vaccination. Well, I want you to come up here, ma'am, because you can't lay on me. Um, so basically, that's what is going on in my neck of the woods. But I just want to always make sure that we all stay protected and safe, and that we make sure that all of us are able to keep up in what we need to do, to make sure we stay that way. But with that being said, and I'm going to go into our trending topics here in a moment, and I'll be back. I'll get everything set up for that, and I hope you guys will join us for trending topics. Where today the trending topic is going to be where fentanyl. We're going to start the topic on fentanyl and talk about it because fentanyl is really serious, and Robert De Niro and how it affected somebody in his family. So come on back, guys, and let's talk more about that. And I'm going to get things situated and be right back with you for trending topics. And stay with us throughout the coming weeks as we will have our host, our guest on our show as I host more information about the homeless population and her documentary, ouch, that she did on the homeless, and how so many of them are very young in age, and some of the things that created their homelessness. So we're going to be studying that more in the weeks to come. But I'll be right back with trending topics. And thank you guys so much for joining me. And I appreciate you more than you know. See you in a moment. Mwah.